Hi, I'm Erin. In preparation for the OIIAQ inspection at the end of January, we have created this short 6-minute video to review the LPN scope of practice. At the end of this video, you will be able to list the 9 LPN reserved acts, describe the 2 authorized activities for LPNs, and understand the contribution of LPNs in certain clinical situations. LPNs work in many sectors at the MUHC and have a distinct scope of practice.
Let's review the 9 reserved acts for LPNs.
1. Apply invasive measures for the maintenance of therapeutic equipment.
What does that mean exactly?
LPNs can provide care for catheters, drains, and stomas. Some examples include urinary catheters, JP drains, and PEGs. Exceptions include chest tubes, epidural catheters, and external ventricular drains. For stomas, the LPN can provide care after the first 72 hours post-op. 2. Take specimens according to a prescription.
LPNs can procure many types of specimens. Let's look at the list.
Urine and stool specimens, swabs from the throat, eye, ear, and nose, swab from a wound, expectorations including nasopharyngeal aspirate. There are some restrictions. LPNs cannot procure specimens from a chest tube, a peritoneal catheter, or an external ventricular drain. These specimens must be procured by the nurse. 3. Provide care and treatment for wounds and alterations of the skin according to a prescription. LPNs can apply or change a wound dressing, including wounds with drains or backing, remove staples or sutures and apply steri-strips, apply products for wound debridement. There are some restrictions. LPNs cannot manage central line and dialysis catheter dressings, dressings for chest tubes, vac dressings, and compressive dressings, and the first postoperative dressing change. These are managed by the nurse. It's important to note that the assessment of wounds is the responsibility of the nurse. 4. Observe the state of consciousness of a person and monitor neurological signs. At the MUHC, the verification of neurological signs by the LPN is limited to stable patients. Trauma patients and patients post-fall must be evaluated by the nurse. 5. Prepare medication according to a prescription. It is important to note that LPNs can only prepare or verify medications they are permitted legally to administer. 6. Administer prescribed medications and other substances by all routes other than IV.
LPNs can administer medications by various routes: oral, sublingual, subcutaneous, intramuscular, topical, inhalation, ophthalmic, and auricular.
LPNs can administer medications and other substances via gastrostomy and jejunostomy, via nasogastric tube, and use a feeding pump. 7. Participate in vaccination operations under the Public Health Act. LPNs can perform pre-vaccination data collection, consult the vaccine registry, obtain authorization to administer the vaccine from the nurse or physician, prepare and administer the vaccine, and record the vaccination in the vaccine record. When a nurse and an LPN are working together, the nurse is obligated to assess the patient prior to the administration of the vaccine. The time period between the assessment and the administration of the vaccine should not exceed 2 hours. 8. Introduce an instrument or a finger according to a prescription beyond the nasal vestibule, labia majora, urinary meatus, or anal margin, or into an artificial opening.
That was quite a mouthful. What does it mean exactly?
It means that LPNs can insert and remove a urinary catheter, insert and remove a nasogastric tube in certain clinical areas at the MUHC, perform anal stimulation and rectal curettage, and administer an enema. It is important to note that the verification of NG tube placement is the responsibility of the nurse. Just a reminder, positive patient identification, also known as double patient identification, should be performed prior to any intervention. 9. Introduce an instrument into a peripheral vein according to a prescription to obtain a sample. LPNs can perform venipuncture in order to procure a specimen. They can also procure capillary specimens. LPNs cannot procure specimens from a peripheral or central catheter. Another best practice reminder: always label specimens before leaving the patient. This avoids wrong blood in tube. Let's review the 2 authorized activities for LPNs. 1. Contribution to IV therapy. LPNs can insert or remove a short peripheral catheter, irrigate a short peripheral catheter with NS, administer a solution without additives, maintain and monitor the rate of infusion. LPNs may not perform these activities in pediatrics. 2. Care of a tracheostomy connected to a ventilator. The care of a tracheostomy connected to a ventilator is restricted to long-term care.
At the NCH, there are exceptions that permit this type of activity in certain long-term care patients.
Now that we have reviewed the 9 reserved acts and the 2 authorized activities, let's look at some specific clinical situations.
What about collective orders?
LPNs are not authorized to initiate collective orders.
What about verbal orders? LPNs may not take verbal orders or transcribe medications. They can, however, perform independent double checks for medications they administer and perform narcotic counts with a nurse, but not with CPN. What about the therapeutic nursing plan, PTI?
LPNs cannot initiate or adjust the therapeutic nursing plan. LPNs should advise the nurse if modifications are required. Thank you for taking the time to view this video. For more information, you can consult the reference guide on the intranet.